this week for our lecture of volume 2 of the 12-week neuropsych didactic series that brings you lectures from experts in the field covering different topics each week. Okay, so let's go to the next slide. Okay, so let's go to the next slide. This series was created by trainees and early career neuropsychologists to provide free, high quality didactic opportunities. Okay, let's go to the next one. So we would like to thank our sponsors for their financial support for this series. We couldn't have done a lot of this work without them, so we really do appreciate their time and investment. Before we start, I just want to go through some disclaimers for the series. This training is not meant to replace any formal education in neuropsychology, and the views of the speakers are of their own. Okay. Questions can be submitted via the Q&A box on the lower left of your screen, and a recording of today's lecture will be provided on our website later this week. Now it is my pleasure to introduce Dr. Valencia Montgomery for today's lecture and on the advocacy in neuropsychology, important considerations from the clinic to the profession. She is a colleague of mine. She's also part of the Society for Black Neuropsychology, and I'm sure she'll get into more of her background as well. So give her your time. Thank you.
Thanks, Will. Hi, everyone. I was so excited when Dr. McBride asked me to do this didactic on advocacy because it's something near and dear to my heart. I am a co-founder and director of research for the Society for Black Neuropsychology. I am a neuropsychologist on an inpatient unit at St. Joe's Mercy Hospital in Ann Arbor, and I currently serve as the treasurer of the Michigan Psychological Association. I completed a 2-year postdoc at UCLA in the Alzheimer's Disease Research Center there. I did a 50-50 postdoc, 50% of it was research and the other 50% was clinical. And I completed my internship here in Ann Arbor at the VA. My degree comes from Roosevelt University, so I'm a Chicagoan. So for all you Chicagoans, I'm gonna send a shout out to you. Born and raised in Chicago, and that's where I pursued my degree. And I'm happy to be here today. So let's jump in. So just an overview of what I hope to cover today, and I'm going to try to, condense as much as I can. What's advocacy? We're going to talk about public advocacy, practice advocacy, research advocacy, and student advocacy. And then I'll do a quick summary. So what is advocacy? Advocacy is defined as the act or process of supporting a cause or proposal, the act or process of advocating for something. So why should we become involved in public policy? Well, as psychologists and students, our training and expertise make us uniquely qualified to contribute to the development of federal and state policies and programs. We have psychological knowledge that can contribute to analyzing, understanding, and resolving key problems facing our nation. Federal and state policies affect our welfare as individuals, educators, researchers, practitioners, and students. If you don't speak for our field, for whom it benefits, who will? So we have to learn to advocate. So in my perusal of the literature on this subject, I came across APA's Public Interest Government Relations Office. It's called PI-GROW. They identify social issues where psychology has relevant and unique knowledge. They determine whether to support existing or create new federal legislation consistent with the advocacy agenda. So they help set the advocacy agenda for APA. Monitor implementation of existing legislation, provide input to federal executive agencies, and increase awareness in the field regarding the need for advocacy. So this is actually a group of people where if you're interested in at the federal level, You can get the information. I've included the Psychologist's Guide to Federal Advocacy information, which is what this was pulled from, at the bottom. If you're interested in advocacy at the federal level in a public way, getting in touch with this group and finding out how you can volunteer, what's going on in the legislature, what's coming up on board that really needs our attention. Just even knowing those kinds of things can help you advocate for our profession. So how do we influence legislation? Well, the establishment of programs or agencies like the Affordable Care Act, the Garrett Lee Smith Memorial Act, the Ryan White Care Act, the authorization of these programs and agency and the funding and appropriations are part of legislation. So when these things come up, these are things that our profession or people that know our profession and know what we need, we can speak out on those things. Some of these things are in the news right now when you think about the Defense of Marriage Act, even the Civil Rights Act. All of these things, they have a psychological component to them that can affect not just us, but our patients as well. So we want to be in a position to influence the decisions that are made at the federal level for these reasons. We don't want people being able to get rid of acts that are important or that might be harmful to us or our client base or the public. There's also a way to advocate at the association level. So we can make changes to programming to reflect important concerns, issues, and training for psychologists and students. We can using the voice of the association to enter into the community and raise awareness of the profession. We can do it by providing support, both financial and expertise, to the creation of case law. We'll talk a little bit about that in a minute, but when you think about working at an association level, you have federal laws that affect psychology licensure or the field of psychology, and then you have state licensure laws that will also impact us, okay? So it's important to know what's going on, and the associations are important because they are constantly watching for things that are coming up on the docket and any changes that people are trying to make to, say, your pay per hour for Medicare. All those things are important to us as a profession, but they also reflect how we provide services to the community, to our patients. So case law, let's talk about that. One way to impact case law is through amicus briefs. They're legal documents filed in an appellate court by non-litigants with a strong interest in the subject matter. The briefs advise the court of relevant additional information or arguments that the court might wish to consider in a case. So you might be thinking, how does this matter to the field of neuropsychology? And that's a very good question. Recently, I had the privilege of being privy to this amicus brief that we were requested to contribute to financially for MPA to pay attorneys to file, and it had to do with third-party observers at the neuropsychological examinations. And basically, this individual wanted to either sit in, and when they couldn't sit in, they wanted to videotape the neuropsych examinations. And as a group, there was a number of associations. Our neuropsychology associations were involved in this. Our state association was involved in this, and an amicus brief was filed to argue against third-party observers at neuropsychological exams. And thankfully, we have literature that explains and supports why it's not a good idea to have this happen. So depending upon the outcome of that, it can then become case law where if this were to happen in another state, they could cite this case and how the judge ruled and admit it as case law, saying, in the case of whatever the name of the amicus brief is and the lawsuit is, the judge deemed that yes, it's not in the best interest of the patient to have third-party observers at these examinations. So the other idea is, how do we raise awareness of who we are and what we do? So often when people ask me, what is a neuropsychologist? And I always take the time to really try to explain to them and explain why we're important, why we would be important, or when they might need services from a neuropsychologist. It teaches them to be good consumers of services. It helps them to learn to advocate for themselves and ask the right questions. And it also teaches them about brain health. So there are many ways to do advocacy in this way. One of the ways that I've done it is by partnering with community associations. When I lived in Los Angeles, I worked with the Greater Los Angeles Alzheimer's Association, and I often went into the community and gave talks about Alzheimer's disease, which is my area of expertise, to talk to people about it and to answer questions. And I volunteered that time because I think it's important that we raise the optics of our field. Now, by doing so, it also makes people start to appreciate what we can offer. And I think that we haven't been very good public relations people for our field, for the public, or even sometimes when we think about the medical centers and doctors really understanding the value we can add to patient care and to improving patient outcomes. So here are some examples of how to advocate. At one point this year, the Society for Black Neuropsychology, the Hispanic Neuropsychological Society, and the Asian Neuropsychological Society, amongst other psychological associations, wrote a letter to the COVID task force regarding issues that were either apparent in that community. So for us, it was in the population of Black people and how we were impacted disproportionately regarding COVID, but also speaking to the need for investigation of cognitive problems post a diagnosis of COVID in these patients that have been hospitalized for months, particularly African Americans who have a lot of the risk factors in our community exist sometimes that that were associated or that have been associated with worse outcomes in COVID. In leadership roles, such as me, I'm the treasurer of Michigan Psychological Association. When you think about people like Dr. Block and others, they're part of these associations. They're not just given titles, they're actually working, and they're working on behalf of our field. And that is so important. Again, community engagement. For me, it was the Los Angeles Alzheimer's Association. Here in the Detroit area, I am connected with a state representative, and I go out to her events. Well, prior to COVID, I would go out to her events and I would talk to the community. Again, talking to the community, educating them about Alzheimer's disease. And then in education, so even when you're in school, there is a way to impact the profession. When I was at Roosevelt University, it's a PsyD program, and I was so interested in research that the opportunities just weren't there. So I went to our chair and I said, I want to start a student organization focused on research, you know, and she was like, okay, I'll be the advisor. And that was in 2013. That organization is still going strong at the university. We got papers and posters during that organization. And it allowed many of us to really dig into research in a way that we were interested in. Sitting on an IRB committee is another way to contribute and advocate. At Roosevelt University, I was part of the IRB committee, learning how to review, learning what was important, learning the rules, the federal rules, and I didn't just wait until I had to do the CITI training. So I was actively involved in the process, which gave me a different outlook. And I'm currently on the IRB at the hospital that I work at, as well as the research committee. And then sitting on committees, whether they're committees at your school, whether it's the ANTS committee, whether it's a committee at your state organization, become involved. Even at the student level, there's a chance for you to use your voice to make a change for our profession. I feel like I'm talking so fast, so forgive me. I'm monitoring my time because I have a tendency to go over. Okay, so factors for inadequate information in the public domain. So there is misinformation in almost every field that's out there, right? But that misinformation and correcting it starts with us individually. It starts with our own motivation and sense of responsibility to engage in public awareness and education. Our knowledge of methods that can be utilized to this end, our own limited awareness of tools that exist for such awareness efforts. And this is the ADDICS 2010 article on increasing awareness of clinical neuropsychology in the general public. And there are various ways, again, to participate. You can develop printed materials as an association. You can do public speaking engagements, and again, volunteering in associations. So let's talk about advocating at the practice level. I found this article with Postal and colleagues from 2014, and it talked about this 360-degree advocacy model. And it's a model for high impact advocacy in rapidly changing healthcare. So it's almost, I don't want to call them a watchdog organization, but really they have their hand on the pulse, and they're there to jump in on a regional level when a regional issue arises, because they understand that it can start regionally and expand nationally. So the challenges cited in this article was maintaining both access to services and favorable practice climate and regional variability. So we know that from state to state, the laws may vary. From state to state, insurance companies' compensation may vary, except for Medicaid and Medicare, really. But I might be wrong about that, so don't quote me on it. So this was the model, and the interorganizational practice committee consists of all of these organizations, and many of you can see right away that our neuropsychology organizations are amongst them, but also our state and provincial boards, territorial organizations, and regional organizations. And so there was this quote that I wanted to pull out because it just describes what was going on that caused them to want to get together and have an action about this, okay? So basically in Florida, Puerto Rico, and the Virgin Islands, there was an announcement that they were revisiting local coverage determinations for neuropsych services. So basically, to sum it up, people were trying to set a limit, a limit on how long it should take for a neuropsych test. So basically they might say, you know, if it's taking, people are billing 8 hours, they might come up with, oh, maybe we should only pay for 4 hours. And so I'm summing this up, but you can read this article. And they were also trying to restrict neuropsychologists from using or relying on self-report measures and things like the MMPI. Or projective techniques such as Rorschach. So it also had this ambiguous language that appeared to potentially restrict reimbursement for feedback sessions. So just me saying that, those of you that are in practice, those of you that are interns, it might automatically make you say, oh, that would be not such a good thing for our profession, right? And so again, when you think about case law, and you think about how these changes can roll out nationally, had this been allowed to go unnoticed by anyone, and they just had their meeting and no neuropsychologist, spoke up, they might have been able to pass this, which could then be rolled out nationally, because other people might say, oh, well, hey, we were able to do it here, let's try it here. But what happened is someone was paying attention to what was going on in the legislature, and this organization went in to address it. They first drafted language changes to the LCD. It directly informed by team members' experiences in state with First Coast. So in the area, they got, information, they gleaned information from professionals already practicing. They sent a letter to the member organization outlining the new language with a rationale explanation. They sent out a grassroots letter to psychologists throughout the state association listserv and local MP networks, and it resulted in over 60 individual letters sent by neuropsychologists in Florida to First Coast. And these efforts resulted in substantial improvement in the LCD for practicing clinicians. So again, in the end, yeah, it's work, but in the end, we all benefit from it. And it's important for the continuation of our field. And for, let's not forget, and for good patient care. So what are some other examples at the practice level? I'll give you one of my examples. When I work in an inpatient unit with patients with strokes and all the other things, but also with recovering people recovering from COVID-19 who have been in the hospital for weeks and were intubated for like a month or more. And when we started getting these patients, and I was reading all of the literature that talks about all of the cognitive or neurological problems that these patients have. We have the happy hypoxics that they call them, or the people that are walking around with low oxygen levels before they even know that they have it. They have COVID because they're not really experiencing the breathlessness. And I went into a meeting with the attending physicians and I said, I would like to test all of the people that come onto the unit. I would like to provide some cognitive testing for them. And I gave them, I outlined all the things that were being reported cognitively or neurologically with these patients. And they agreed immediately. And I established a COVID battery. So that's one way. I'm advocating for patient outcome, but also for the research of it, right? For us to be able to understand and have evidence to continue to move on from that. There are ways to advocate at the practice level in a multicultural way. So an example of that would be a patient on the unit that didn't speak English as a first language, but had a stroke that caused aphasia, global aphasia, and really getting the staff to understand at a cognitive level, if you're speaking English to this person because you say it doesn't matter, they don't understand anyway, how will you know when they first start to understand the words if nobody's giving them the language, speaking to them in the language that they're familiar with? So advocating even at that small level where you're saying, hey, I can't test them because it's not appropriate. But secondly, we should really be using interpreters with this patient because we do want to be able to identify when their language begins to come back. Working with some of the other professionals to increase good patient outcomes. So a great example of this would be, I work with a speech pathologist with someone that had COVID. He was our patient 0. And at the beginning of his stay with us, about a week and a half into it, I did a test with him. And based on the results of that, I came back and I talked to speech and I said, can you really focus on this area with this patient? And by a week before he left, I retested him and we saw a really nice improvement in his cognitive functioning, but not just that, his functioning overall. So making recommendations at the peer level, at the colleague level that can help patients. And then collaborating with other professionals and really helping them to understand things from a neuropsychological perspective, because we're the only ones that can bring that perspective. Time check. Okay. So there was this interesting article, because maybe even advocating at the level of the actual disorder. So this particular article, or this journal article, was really looking at how neuropsychologists are in a unique position to advocate for patients with epilepsy because of our understanding of behaviors and cognitive effects associated with the disease, the progression of it, the treatment, how the treatment allows for effective treatment. Helpful communication with patients, family, school, and employers. We have a chance to really make a difference in their lives, and there's a way to advocate for them. And what I really liked about this was that they shared a development of a seizure action plan, and it's something that I've done similar to patients and families to help patients who are really afraid of having a seizure when they're out in public, to help them plan for a seizure, including having a little card with them where if they have auras and they know they're having an aura, they can try to find someone to hand the card to that explains that they have a seizure disorder and they're about to have a seizure, and asking them to please stay with them. You know, they don't have to do anything, just stay with them until it's over. And so it can also include helpful information about what to expect with the individual seizures, because we know all seizures are not alike. We can provide education. So neuropsychologists can work with the school psychologists to explain differences in declarative memory that can be associated with epilepsy and learning disabilities. We can help children get other health impaired disability services when the criteria for learning disability is not met. And we can assist the family in long-term planning. Breathe. Research advocacy. So you might think, seriously? Advocacy and research? Yes, there's so many ways to advocate in research for the profession. We can advocate for equity and participant representation. What do I mean by that? I mean, making sure that the research that we're reviewing, that the research that's going out there, that the grants that are being given, that the researchers have adequate programs or adequate recruitment plans to recruit from minority groups. We can make sure that by advocating for participation in review of journal submissions. So if you're a supervisor, advocating for a student to be able to go along with you and do a review, and in that way it can be a didactic experience, professional development, to give the future reviewers a chance at having someone go through the process with them step by step. By providing feedback to journals regarding some of the articles that are printed. You see the ones where people have a rebuttal to articles at times. By helping to create criteria for inclusivity on editorial boards. By getting involved in the review process for grants. This past winter, I was so pleased to be part of the National Endowment of the Arts, reviewing grants that were associated with a cognitive aspect of music. And I feel like that's part of like how I get to use my voice in research in another way. And involvement at the government level, making sure that we advocate for the kinds of grants for the kinds of illnesses that we see that are so often neglected in our field. Oh, wow, I talk so fast that I have run through this, so we're gonna have plenty of time for questions. Okay. There are plenty of advocacy opportunities in neuropsychology. The lack of advocacy can negatively impact our field. That's a typo. Individual practitioners, patients, and society. Due to our anemic presence in associations and other spaces that make decisions, most of the critical decisions that affect neuropsychology practice are made by non-neuropsychologists. Inadequate information in the public domain is our job to rectify. So, in closing, I posted this because whenever I think about advocacy, I think about the late Representative John Lewis. And has often said, get out there and push and stand up and speak out and get in the way the same way that my generation got in the way. Get in trouble. Good trouble, necessary trouble. Find your passion in the field. Whatever you're passionate for, I can almost guarantee you there's a way to advocate. Serve on a board, a committee, or leadership in your organization. Start simple. You don't have to go for president of APA quite yet. Money is always helpful. So if you've heard this and you say, I just am not a person that gets out there in front of people, use my voice that way. I'm not going to get on the picket line picketing. I'm not going to march. But I have money and I want to use money in that way. It can always help organizations. Find the organization you want to support. And within that organization, you can even restrict your donation to a specific cause. So I think that I have run through this really quickly. There's resources here if you want to learn more about federal advocacy. You can go to the apa.org advocacy guide, federal guide. And then these are all resources. There was a wonderful special issue of the Clinical Neuropsychologist that was all about advocacy in neuropsychology. And it was done by some of the the great people in our field who do so much research. And it was in 2010, so look for that article. One of the things I didn't discuss was advocacy for neuropsychology in the public sector where the VA is concerned. There's a whole other different realm of looking at advocacy for the VA experience, for neuropsychologists within the VA, for patient care within the VA. And then there's also advocacy and forensic practice of neuropsychology. I think that's also an area. I didn't want to leave out the forensic neuropsychologist, but there's a way to advocate for that as well. So, and then there's one that's the training leadership blueprint, which is opportunities, benefits, and it's a call to action for students to get involved and for supervisors to help them get involved. And then there's another one for women and advancement in neuropsych. So if your issue is like, we want women to advance more and be heard more in our field, this particular article provides real life lessons learned in that pursuit. So yeah, I think, oh no, I have a lot of resources. And Dr. Pliskin and Hal and they do a wonderful job of summarizing the entire special issue of all the points. And so, like I said, it's amazing how much is out there specifically for neuropsychology, but once you find your passion, look for one of these articles, read through it, and then start reaching out. I'm sure lots of people would love to help you.
Okay, well, thank you so much, Dr. Montgomery. I think we definitely have a few questions, but one thing that I was just wondering, how can you speak more? The audience that we have is a largely trainee audience. Can you speak to who to ask? You know, how to ask, how to get started? You know, speak more to your experience and relate that to maybe some of the trainees who might not know how to get started in that way?
Yeah, that's a good question. Well, thank you. I mean, I think it just depends on where you are. So if you're at a school that has a social justice mission, talking to advisors and faculty that are involved in that kind of thing, even your community psych, if your community psych teacher, the faculty in community psych are likely to have a number of ways you can be involved. If you're looking for like federal, state level, and the legal area. If you're looking for working with like a student organization or working with a state organization, simply becoming a member and reaching out to the membership committee that you might be interested in working with. If your focus is advocacy, it's reaching out to maybe the president of that organization and letting them know what you're interested in and that you'd like to be able to shadow their person that does their lobbying. So yeah, because most associations have a lobbyist that make sure that our voices are heard. And so it depends on what the interest is. It's going to the person that's the nearest person that has authority or has experience in that area and just telling them you're interested. That's how I've done it.
Okay, great. One of the questions that we have from the Q&A, can you speak to advocacy through the use of culturally diverse normative data and research and how best to find this data?
So say it again, Will, I'm sorry.
Can you speak to advocacy through the use of culturally diverse normative data and research and how best to find this data?
That's a good question, and it's kind of broad. So I'll use an example of the National Alzheimer's Coordinating Center because everything with me is about Alzheimer's apparently. That data collects demographic information, and if you wanted to do an original analysis of some component of all of the many variables they have, it's easy to request that information. Make sure that you have IRB approval before you start the process. And then to use it, however, whether you're trying to write a paper or whether you're trying to do a poster presentation. most research is not sorted out by, you know, minority, whatever, unless it's like literally just looking at that minority thing. So when you're thinking about, if you're thinking about data that's already been collected, you usually have to request the variables for race. And not all, if you've ever read an article that actually outlines race, sometimes articles don't even include that. And I don't know if it's because their database just didn't include it or just because they didn't want to report on it. But it's not always easy even to find that information. And I don't know if I answered that question, but I hope I did.
Okay. Um, One of the other questions that we have is about your COVID battery. Can you go into more detail about how you came up with the idea for your COVID battery, or where did you get the idea, or what did you use in your line of thinking to develop that battery for those patients?
Yeah, I guess the biggest thing for me was when people have something like COVID, I would expect that we would need to repeat testing in a shorter span of time. So I wanted a battery that gave us not really like the deep dive neuropsych, but a broadly, globally, how is this person functioning? And then, branch out from there. And so for me, the best thing in an inpatient setting where patients cannot sit for long amounts of time for a neuropsych eval, I chose the RVANs because it has several forms. And so that allows me to, if I want to look every month or if I want to do it in 6 weeks time, I don't feel like the learning effect is going to be a problem.
Mm-hmm.
Trails A and B, because they're either going to do it or they're not going to, it's unlikely that they're going to memorize where the circles are. Fluency, the same thing. I usually do verbal fluency, the FAS. And I always do emotional component, but there's also this research out about how a lot of people with COVID have anxiety about getting off of oxygen because they're worried that they won't be able to breathe, right? So these people have been intubated and now they're on oxygen. And as we try to decrease their oxygen, what we notice is an increase in anxiety and their unwillingness to engage in like actual physical therapy because they're worried about that feeling of not being able to breathe. So there's a measure, and it was adapted from the pain catastrophizing scale to look at like basically breathing catastrophizing so that we can also evaluate the psychological components along with that. So that was my reasoning.
Okay.
I don't know if that helps.
One of the
I'm sorry, and a premorbid estimate. So I use the top F.
Okay. Another question we have for you. Somebody wanted to say thank you for mentioning the VA, and they're curious in terms of that context. How do you go about advocacy? Oh, it just disappeared. Advocacy as a federal employee at a VA, given that there might be some restrictions.
Yeah, and so that's the thing with the VA. Get this article because that's what they're dealing with. Not just let's do research in the VA, but sometimes just getting through the IRB in the VA is a big deal. And it's kind of like a protected population in some ways, but there are ways to advocate. Usually the VA has committees, and guess what? If they don't have a committee and you have a supervisor that you can go to and make an argument for developing a committee, that's another way to advocate. Sometimes it's just at the individual patient level where you may be, maybe this person is being perceived as something that, based on your testing and stuff, they aren't. And what I mean by that is I've had experiences where people ask me to do a capacity eval for someone, and it turns out that the person has capacity, but they also have low literacy, or they are, borderline intellectual disability that was never diagnosed. And in being able to advocate in that way, going that extra step to say, I really want to do a good job for even that is advocacy, and that can be done in the VA. So yeah, I've trained at two VAs, and each time there were committees that I was invited as a student to be part of when I was on externship, and on internship I could be involved on committees, get on the ethics committee, of the whole VA system. There's so many ways to do it.
Okay.
I'm a little passionate about this, sorry.
No, it comes out and it's very much appreciated. Okay, we just have a few more questions. Can you speak about advocacy in the context of the differential power dynamics? So as a trainee, for example, as a trainee in a program where your mentor may not want you to advocate.
Okay, may not want you to, that's concerning. That's concerning, first of all, because we should want people to advocate. It's just how we advocate that matters. And, I'm never gonna advocate for anyone to be disrespectful to their supervisors or who they report to, but you can always phrase it as being curious as part of your training, right? As trainees, we're expected to come to our supervisors with these professional development questions. So if you have a concern, phrasing it as a question, I'm really interested in understanding how this is this way, just so I can know for when I am independent. As part of my professional development, I'm really concerned about, the dynamics with multicultural, norms that we use. Can you help me understand better, how we can be giving these diagnoses? You understand what I'm saying, right? So it's how you approach the subject. It's not like you're in a position like me to say, hey, I want everyone to have this test because of this, and have my colleagues say, that's a really great idea, thank you for bringing it up, versus me being a student saying, hey, I want everybody to have this test, right? So maybe if I were a trainee, I might go to my professor and say, oh, I've noticed we started getting, I might go to my supervisor and say, I noticed that we started getting referrals for COVID patient, and I've been looking at all the data around it. Would it be a good idea to recommend to some of the other departments that are seeing these patients to maybe refer them to neuropsych for a battery? Why would that be a bad idea, or why not? I want to understand how, we reach out to our colleagues when we think that there's a concern, right? Because then you're asking to be taught rather than telling them what they need to do for you.
So you're planting the seed in their mind. It's kind of a reverse psychology thing almost.
And
Alrighty.
supervisors out here are probably cringing right now.
One of the last few questions that we have, one of the participants wanted to thank you for the talk. Can you talk more about how to navigate advocating for our patients, especially when they are impacted negatively by social detriments of health, such as poverty, racism, socioeconomic status, those things?
Again, I like to approach everything rather than from confrontation, from curiosity. So, perfect example, when this thing happened where I was observing a patient, people using different means to communicate with a non-English speaking person, I went to all of the supervisors and I said, can you tell me how we determine the need for a translator? I mean, what are the standards for our hospital? And I went to each one. And after each one answered, I would say, are you aware of this patient? And I would give them the situation. And ultimately, we have a steering committee. And at that committee, it turns out that there was already a way in place to address it. It's just that nobody had really known about it. But, I went into it asking for information and then providing information and my expertise. So, this patient, English is not their first language. They had a stroke. They don't have language right now. And how will we know the difference? So, everybody, I hope, has the patient's best outcome in mind. So if you approach it right, then there's no reason really for people to have pushback. At the same time, you can't be surprised if there is pushback, because some people don't like it when they haven't, when something's pointed out that they didn't know or that they didn't consider. So it's never going to be a case where you never have pushback. And that's why John Lewis said, get into trouble, necessary trouble, is because sometimes it's got to be more important to make sure our patients have good care than to worry about somebody being mad at us. afraid. Hopefully our supervisors encourage that kind of curiosity.
That's really great. I really appreciate that. Another question that we have, are there educational workshops? Does APA or does any of the neuropsych organizations offer any training or mentorship on this?
I'm going to throw that back to y'all. Dr. Block, do you know?
That's a good
Yeah,
question.
APA offers at the convention every year, there's usually something related to advocacy. And then they also have a leadership development program. Annie, I think you've been involved with that, right?
Yeah, I represented Division 40 as part of the APA Leadership Development Program. And part of this development program was to learn about advocacy and how can we advocate as psychologists. And we were able to attend the Practice Leadership Conference, which is held every year around March. And the students and trainees, we learn how to advocate. We were actually supposed to head to the White House and actually meet our senators and representatives, but however, because of COVID, certain states decided not to go. But we were able to, call the senators and talk about different bills that APA is pushing forward. So that's
Yes.
another opportunity.
Yeah,
I think
was just
APA really does a lot for psychology in general, but also neuropsychology. And I think sometimes, we get drawn to these neuropsychology specific organizations, which are great, but I want to urge trainees not to forget about APA because, for example, the recent CPT coding changes came from APA and advocacy. And part of that effort was driven by neuropsychologists like Antonio Puente and Neil Pliskin, who worked tirelessly to make those changes that benefit us as neuropsychologists. So, if there is opportunities within APA, like Annie mentioned, and Dr. Montgomery mentioned, I really encourage you guys to get involved.
Yeah, thank you, Annie, because I was just going to say, as a state representative, I was one of the diversity PLC people that were going to go to Washington, but because of COVID, I decided out of an abundance of care to stay home and I didn't go. But that's an opportunity because those states, they're always wanting to send representatives. And if you're on the committee, you express interest, you wind up going. And I know our state organization paid for all the attendees to go. And so it gives you a very up close look at the federal way to contact, representatives and voice your voice. Thank you, guys.
Thank you. Well, I think that's all the questions that we have for today. I think we're going to wrap up at this point. I know I wanted to say that it was announced in the chat, but next week we're going to have a primer on NIH fellowship and career development grants on Monday, October 16th at 1 p.m. Pacific Standard Time, 4 p.m. Eastern Standard Time by Dr. Sean McClintock. Dr. Montgomery, we greatly appreciate you, the time that you've given to us and speaking on advocacy and neuropsychology. I know I learned a lot, and I'm hopeful that this will have been helpful to a lot of the trainees to, build their advocacy voice in a way. So we thank you for your time.
Thank you for having me. It was great.